Welcome everyone. So can you all hear me well? Okay. My name is Carolina. I'm the co-coordinator of the public health program at TCNJ, the College of New Jersey here in US. I'm originally from Brazil, but now I'm serving here at TCNJ as assistant professor. I teach public health, all other courses related to public health, like introduction to epidemiology, history of public health. And firstly, I'd like to thank James Lynn Institute opportunity and the invitation to give this lecture for you today. And also I'd like to thank Dr. Suhail for this invitation. You can ask me questions, you can post questions here, or if you want, you can stop me anytime, or I can share my email with you all, and if you have any questions, please let me know that I'm glad to answer all your questions. All right? Okay, let's get started. Our lessons outlined for today, we're gonna overview, so we have So Interesting if you like public health. So this is the class for you. The goal of public health, we're gonna go over the scope of this beautiful area of knowledge of public health. Some of the public health accomplishments, the public health system, our approach, public health interventions. We're gonna also go over the history of public health, some important points of our timeline, of our historical timeline, the evolving need for public health starting 1700 to 800s, and then beginning from 1900s to present. Also, we will save time to talk about the public health today and our challenge and the future of public health. So with all the current outbreaks, what is the most challenging tasks for now, the public health practitioners and the public health advocates. We're going to talk about the determinants of health, social determinants, biological determinants, essential public health services. We're going to talk about the workforce of public health, the core functions, link health, and the development of nations and countries, the concerns of the field, ethical issues that we need to be aware. Public health, the health protection, health prevention, and health promotion. So I have a question here. Okay, I'm just reading one of the questions here. Public health and the environment. So what type of interventions do we have nowadays? So what are the strategies that we use? Our tools, they're universal tools that we can apply everywhere. And finally and lastly, talked about the roadmap, how to train the public health workforce. So for public health, as an overview, you can understand public health as a very dynamic field or a very dynamic area of knowledge. So public health is truly a multidisciplinary but I prefer calling interdisciplinary field. We combine and we invite different areas of knowledge to be together to achieve our main goal is to improve people's lives. So the common goal, and if you are working into public health career or public health field, we do believe that we can make difference and we can impact the societies where we live. And here, one of the definition of public health as the activities that ensure conditions in which people can be healthy. These activities include community-wide efforts, identify, prevent. For identification, we have to conduct needs assessment to understand the community needs and what are the best way to achieve our goal. Also, another good word for public health, don't be afraid of the new words because all the disciplines, we have our jargons, but if you do not understand any concept or any new word, you can ask me. So a new word, I think it's not new for you, but outcome, it's a good one. So outcome, when we talk about the outcomes, they are the result or any type of a result that we would like to achieve by applying our strategies in public health. So basically, we are identifying the needs to prevent diseases. And when we talk about the diseases, not only the contagious diseases anymore, also we are facing the chronic disease. We're going to talk about this in a few slides. It's the epidemiological transition because we are aging. Population is getting old, and now we have the chronic disease. And some of my students, they ask me about the difference of clinical medicine and public health. One doesn't exclude the other. No. We need to go along and to stay together. But in my case, I'm a dentist. I make fun with my students saying that I used to be a dentist in the past and I discovered public health. And so providing individual care is clinical individual care is not saying that public health is not concerned about individual care. The challenge for us is thinking more in a scale way, because we need to solve and try to give the best answers to help the development of quality of life of populations and nations. So this is basically the difference between the clinical, medical, and the individual approach and the collective approach. So yes, anyone wants to say anything? Can anyone just reply me here on the chat saying, yes, we can hear you? Okay, thank you. Okay. And so to finalize our idea here, dentistry, physicians, nurses, they treat one individual at a time. For us, public health, we would like to come before the diseases, and we need to keep our thoughts thinking collectively, thinking on a large scale. Here is some good words for us. So public health deals with health promotion. So health promotion and health prevention, they're quite different. Prevention is coming before the development of a specific disease and dealing with specific groups that we call vulnerables. Health promotion is broad. It's all sorts of initiatives, global initiatives. It's not from the health field. And this is the moment that we invite all our stakeholders to think about the best strategies to face the challenges of a community or a state or a city, county, or an entire country. Public health, it's also concerned and covers surveillance. Keep following and tracking and monitoring the distribution of diseases, any outcome related to health. We track and monitor risk factors, protective factors, disease, injuries, and so on. So also public health, we deal with epidemics, and I think that you all know one example of a current epidemic is the Zika virus and Zika fever and the relation with the microcephaly. So public health is the field that we analyze what's happening, and we try to find and really to find the cure, or to find the best way to prevent, or find the best solutions to combat epidemics. Disease prevention, we do this all the time. Communication, we have an important area of public health. It's health communication, also risk, and we have a great number of excellent studies here on research. We can list the different types of study design that coming from epidemiology is one of the, it's under the umbrella of public health. Okay. Basically our goal as public health practitioners or public health professionals, we need to, it's not guaranteed, because it's difficult when people ask, so can we guarantee that populations will be healthy all the time? It's impossible. We cannot guarantee anything, but we can provide the ways. We can provide some tools. We can provide knowledge. All those to subsidize changes, all those to subsidize or to a call for action. Here, the biologic, physical, so the goal of public health is to keep the biologic, physical, and mental well-being of all members of the global society. And most important, regardless of ethnicity, religion, gender, sexual orientation, country, or political views. That's where you're saying that, yes, public health, I used to say that if you're a people person, if you care about people's lives, and if you do believe that you can impact the place, country where you live, public health can be a good fit for you. But if you like recognition, if you really like to be under the lights, public health cannot be for you, because we are hard workers, but we are working behind the scenes. So even you know that you're making difference, your team, because most of you, I bet you're gonna be leaders, And so after the graduation, after taking public health courses, no matter if undergrad or as a master's student or a certificate, graduate certificate student, you'll be all prepared to be heads of nonprofit organizations, working at health departments, but do not wait all the lights and all the recognitions. But this is a beautiful profession, I can tell you. And later in another class, we can talk about the career in public health. Our scope. So you see that public health, it's broad, but it's not simplistic. If you like, for instance, the first and very well-known scope that we face and that we address is infectious diseases. Infectious diseases, contagious, communicable diseases. We deal with chronic diseases, heart disease, metabolic disorder, cancer, mental health, nutrition disorders, health of the vulnerable. People tend to believe that public health is just for poor people, and this is a huge mistake. Public health, the good public health, it's for everyone. Remember the past slide, regardless ethnicity, regardless religious, regardless gender, regardless the country you live. But some point we need to keep attention on the more vulnerable people. And here's an example: poor people, children. We call as vulnerable people that person or that group of people, they are under risk or more susceptible to getting sick if we compare to another group. And we call as the vulnerable: women, seniors, elderly, or substance abusers, drugs, alcohol, tobacco. And so again, do not forget, public health, it's for everyone. But in some cases, we need to prioritize some individuals because they are more vulnerable than others. More accidents, violence, injuries, health equity, occupational health. So public health also, it's under our scope. Environmental health, access to health care and quality of health care. And here in some case, war or disasters. So you see, in my case, I came from dentistry. And nowadays, one of my research lines is health disparities. So if you like public health, you can go for nutrition, you can go for adult health, you can go for environmental health. It's up to you. So find the one that you like most, and you can find your place. Some of the greatest accomplishment of public health, we can prevent epidemics. We have in the past and recently the H1N1. It was in 2009 H1N1 outbreak. I told you about the Zika fever, Zika virus. We had Ebola and other types of epidemics. The protection, one of our accomplishments, protecting the environment, workplaces, housing, food, and water. Oh, so all of these factors, environmental, workplaces, housing, and food, are they important to understand and to figure out public health problems? Yes or no? Yes. So when we think about causes of the causes, and if you want to understand in depth the causes of our major problems, public health problems nowadays, we can go back and see lack in sanitation, lack in housing, lack in education. But we had improvements for sure. Also, we are more capable to monitor and track health status of population, mobilize community action, and we can take advantage nowadays of the internet because we are more and more global. This is an example that I'm here teaching you from New Jersey, and you are quite far from me. And we can utilize social media to connect people because money is power. But in the other hand, connected people is also a type of power. Response to disasters, researchers to develop new insights and innovative solutions. So epidemiology, most of the clinical experiments, the clinical studies, they're all the time trying to find new drugs, to develop new treatments, new drugs. So if you like to be at a little lab, also you can find your spot, your place here in public health. And leading the development of sound, healthy policy. We're going to talk about this because public health is entirely correlated, linked to politics. We cannot forget about this. All right. I brought, this is a graph showing the life expectancy. This is for United States, but we are going to talk about other countries. But this is to illustrate. If you check here, life expectancy in years, the vertical line, and year by year. So 1901 is starting at 1901, 1910, 1920, and you can see the two first lines here on the bottom. Let me use a resource. All right. Here, so if you check here, it's life expectancy at 65 years. And here, life expectancy at birth for female and males. Female and male. And you can see a huge difference. Look at, so someone that was born in 2002, for US, life expectancy is 79 for United States, 85 for Singapore, 74 in India, 79 in Brazil, and I checked Kenya. If I'm not wrong, I'm gonna tell you right now. Kenya is 64. So that you can see most of the improvement here and the reasons that we achieve this shift in life expectancy is because public health, it's always working by vaccinations, by improving the collaboration towards improving sanitation. We are also improving and working on water, trying to provide as much as possible clean water to people worldwide. And we're improving nutrition. So all those factors that we call determinants of health, they are biological or social. They are interacting to lead us more healthy. I'm not saying that this is the ideal situation because we still face pockets of poverties. We have so unequal countries. I have my own example. I'm originally from Brazil. Brazil, it's a very unequal country, and we face, so for some states, in average, the life expectancy in Brazil is 79. But if you go and if you do a zoom over the country, you see that we have differences in between states. But in general, and we are really, so we can say that most of the public health accomplishments really will helping people to live longer and people to achieve better lives. The public health accomplishments, also vaccination, motor vehicle safety, safer workplaces, control of infections, we talk about this, declining death from coronary and heart disease and stroke, safer and healthier foods, healthier mothers and babies. We are decreasing the infant mortality because we are improving hygiene. We are improving also improving the healthcare access. Family planning can be one of our public health accomplishments. Water fluoridation. It is proven that fluoride water can reduce by 40% the average of tooth loss among adults and cavities among children and adults, regardless the social status, regardless if they are rich or poor. And lastly here, the association between smoking and lung cancer. Some new policies to protect people, and so this we can be, even though this is a challenging field, we can be glad with the accomplishment. It's not over, it's very dynamic, and if you think that we are solving a problem today, probably the answers that we have won't solve the same problem in the next year and so on. But to modify and to advocate for public health, we need to understand the history and the past to transform and to change a given situation that we would like to. Now, let's talk about the public health system. Public health system, it's a way that we organize to achieve our outcomes. To achieve, what is it? Remember, outcome is the result that I desire to achieve. So within the public health system, and it will differ according to a country, according to a state. Some countries, they do have universal healthcare system, for instance. Most of them, they are organized focusing more on primary care. But this is just a general, a broad picture of public health systems. So consider here all the financial resources that you need to organize the system. The information resources to structure, to achieve the goals, human resources, and here you can see we have the colored small balls. You can see here schools, health departments, churches, community centers, policy. So think here for public health system, all the stakeholders involved into directly or indirectly related or involved to the public health, and all the sources that we need to achieve our goals in public health. And again, we have the environmental health, the employers, employees, tribal, civic groups, churches, and another good point here. So for public health system, we will consider also the private sector. It's not saying that the private sector, they are not allowed to participate. Actually, they are. So inviting and putting on the same table non-profit organizations, public governmental departments, and why not private sectors? Because remember, our final outcome, our final goal is to improve and to keep people healthy, to improve people's quality of life. Let me see how to get rid of this yellow. I don't know if I can to get rid of the yellow risks here, but okay. The public health approach. So keep in mind that first we need to discover the problem. How discovering the problem? Addressing the problem. We start by the problem to find the best solutions, to find the best answers. We start with the surveillance, identifying the problem. So what is the problem? Remember, I'm going to give you an example. We have here in the US an outbreak of spinach consumption. It started in California. It was 2006. So a child, a 9 or 10-year-old boy, started getting sick, nauseated, with headaches. And at the end, we had here an outbreak. It was a bacteria that was infected, that the bacteria was presented on the spinaches, and we had 200 people contaminated by this bacteria. The cause was the spinach ingestion or the spinach intake. So first, starting, what is the problem? Another example, the Zika virus. It started, we have some cases, but then we started seeing the linkage between the pregnant women who had the virus and cases of microcephaly. So first, what is the problem? Define clear, be objective, clear and straightforward. What is the problem? Then illustrate or list the risk factors. Okay, so this kid in California had spinach. So what type of spinach? Processed, raw. For Zika virus, what could cause the microcephaly with the pregnant women? So, and we go for identification. What is the cause? Can be not only a disease, remember, we can be also injuries, or we can also be evaluating a health system. So what is the cause? Then intervention, make a proposal, but always do not only rely on your good intention. Please keep evidence. Please keep strong evidences to subsidize in your proposal. So what works for this specific community? What works? And then make a plan, establish your targets, establish your indicators of success, and then implement, and always constantly evaluate. Do the assessment. If this is the way, okay, if we implement it correctly, if we don't, so let's change our strategies. But basically, this is our approach. Starting with the problem, a very clear problem, or sometimes unclear. Do you know Sherlock Holmes? Do you know that the Sherlock Holmes from the movies? For public health practitioners, this is a good way to remember. It's all the time looking for clues, all the time trying to solve big problems. Not only sometimes small problems, but problems that really affect entire communities, entire nations, entire countries, entire counties. And yeah, so remember about Sherlock Holmes can be a good translation of a public health practitioner. Some intervention strategies. Let me see here to delete the marks. To click on the icon, okay. No. Yeah, it's not working to remove the marks. I'm sorry. The intervention strategies. We have the immunization programs, health education, behavioral modification strategies, community intervention, and mobilizations. Again, if we discover the cure for a disease, or if you have a great vaccine for a disease, we cannot assume that this is gonna really works for the community that we are, because we need, besides having the answer, besides having the scientific evidence, we need help to translate from a scientific and very sophisticated language into the lay language. So some of the times for some DST diseases, we have evidence, we have vaccines, but why we cannot see people really taking advantage of these improvements? Because it's not that easy discovering, applying, assessing. So it's why, and I think this is one of the beauty of public health. This is why we need social and behavioral science. This is why we need biostatistics. This is why we need biology. Because from the microbiology, virology, or pathology, so scientists will discover the cure. But when we talk about behavioral modification strategies, is a word apart. If we know from our personal examples, for instance, if someone tell you, to have a better or to achieve a better health, you should work out every day at least 30 minutes. You should drink 3 liters at least of water. You should quit smoking, but it's hard. So this can be also another challenge for us. Saying that we have the answers do not imply that that community will really take advantage. That's why we need the combination of all sorts of the other areas of knowledge to help us in implementation, behavioral modification, and so on. And also structural interventions, laws, and regulations. Public health. I can say that public health is responsible for providing sound evidence for changes. So if you are in charge of power in your community, or if you are a policy maker, please use public health advices or use epidemiological findings. This is a good and strong way to subsidize the changes. And we are all connected. We have some terms that public health has been used. So if you heard about state medicine, hygiene, public medicine, public health medicine, environmental health, new public health, social medicine, and community medicine, they are all terms that have been used for public health. Again, public health is not a simplistic field. Sometimes people tend to believe that it's all about just prevention or health education. No, it's a combination. Think like a puzzle. So we need expertise from hygiene for sure, from the clinical medicine for sure, from biostatistics for sure, from psychology, anthropology, why not? Because we are dealing with people. We are dealing with human beings. So it's impossible just using one area of knowledge to try to really understand the beauty of a human being. So that's why we invite that's why public health is so interdisciplinary. And again, I prefer the term interdisciplinary instead of multidisciplinary. This is a timeline. Let me check our time here. Okay. This is a timeline of some evolving need for public health. So let's be back at the age, when talking about the age of industrialization. So think with me about the conditions. People started to move from rural areas. Oh, question. Am I talking too fast? Someone can just type and reply me. Am I talking too fast? Okay. Thank you, Abdul. You say no, it's fine. The history of the public health is huge. This is basically a timeline. So I was talking about the time when people started moving from rural areas and going to the cities during the age of industrialization. So they moved from the farms to the cities. So the cities started to swell. The cities started to be crowded of people. And thinking about sanitation, not sanitation at all. So if you check life expectancy for that time, I would probably say that people should die around 35, 40s, on their 30s, late 30s, early 40s. And then all the new approaches, all the new experiments to try really to face the plagues and the problems that we had during this time. For instance, on 1777, the smallpox inoculations started by Lady Mary. That the name also, I don't know if it's the vaccine comes from the name of call in Spanish. It's vaca. And the term originated from this vaccination. And some years ago, after the inoculations of smallpox, we had the development of the vaccine. And I'd like to highlight the introduction of epidemiology. This is the time by John Snow in London. If you want to go and check later, this is a good story. John Snow is considered one of the fathers of epidemiology, and I don't know if for public health, but he discovered the cause of cholera in 1848. So he was there in London. He was an anesthesiologist. And he thought all the cases of cholera at that time in London. And there was one of the districts. He figured out that it could be something in the water. So he started to go in doing home visits. He provided a map, so that's why we call this is a beautiful work for science and for public health. He mapped all the cases of death and also the morbidity of cholera. The morbidity is rating and checking the distribution of the disease in a given district of London. And he was almost 100% convinced that the problem was in the water. And he needed to convince people there that yes, so half of the district received water from a company A, and the other half received water supplied by company B. So one of these companies, they were supplying polluted water, and this was the reason John Snow, at the end, he discovered, the problem was with contaminated and polluted water. Yeah, and so if you want to hear or if you want to read more about this, the history of public health, I can provide you some reference, and then you can check it out. And then the germ theory of the disease by Louis Pasteur, saying that yes, the contagious diseases, they are really caused by germs. Some of people, they say that this is one of the most revolutionary milestone for medicine. And in 1884, we had the 4 postulates of infectious disease by Robert Koch. saying that we can isolate the virus or the germ or the bacteria, and then we can incubate. Sorry. And after this, you can reinsert the virus in a healthy body. It can be, that time was an animal. And late 1800, the unhealth condition of New York Determinants. So this is not all the timeline for the history of public health. We have here the influenza pandemic in 1918 that killed approximately 40 million people in the world. Then we have for the first time we had from the Surgeon General report linking smoking to lung cancer. So this was 1964, when just the first report of several another ones really confirming, okay, yeah, smoking, it can lead lung cancer. HIV in 1981, when the HIV virus was first recognized, and then awareness of relationship between diet and disease. Remember, you are what you eat, and the threat, more recently, the threat of bioterrorism. Remember, again, this is just a brief timeline. Let's talk about public health today. I can tell you that today we have the old infectious disease such as tuberculosis, but now we have new, more virulent strains, the newer disease such as West Nile virus and severe acute respiratory syndrome. If you ask me about our challenges, we know about cells, so bio is an area of knowledge that it is well developed. I think for us, for public health, the most challenging situation now is to face the social determinants of health. Here is saying that infectious agents, they can travel faster and faster. Pandemics are here and showing that yes. And just a quick note, if you don't know about pandemic is when a specific epidemic goes beyond the frontiers of a country. HIV is a pandemic. Ebola became pandemic. H1N1 became pandemic. So all the time when an epidemic goes globally, this is pandemic. The chronic, more about public health today. We had a changing. So at the past, if you check the rank of the most prevalent causes of death in the world, you see that contagious diseases or communicable diseases, they were on the top. But now, if you check the prevalence rate or if you check the mortality rate, you'll see that most of deaths now are caused by cardiovascular diseases, cancer, and another chronic conditions. So this that we call, this is the shift that we call epidemiologic transition. We shift from contagious diseases to chronic diseases. Now we are facing diabetes, heart disease, cancer, and obesity. Obesity is a real public health problem nowadays. And obesity is linked to also heart disease and diabetes that we call as that we can face then applying the common strategy of risk. In the past, for contagious disease, we tend to believe that one germ or one risk factor causing one disease. And now we have the same risk factors for different diseases. More about public health in the future. Although we have good tools, although we have good interventions, although we have good results, it's difficult to predict disease. We could not imagine, again, about the Zika outbreak. We couldn't imagine that microcephaly will be back again on our research agenda. So public health issues are difficult to predict and are episodic, such as the spread of a new infectious disease. Other challenges are very predictable, such as the impact of smoking and chronic disease. So we can have some campaigns. You see new legislation against smoking and tobacco usage. And we have some initiatives, international initiatives, to be prepared. A good place that you can go and search for public health trends and public health content is the website of the World Health Organization. It's WHO, WHO.org. It's a good place. And also the CDC that you can see and also check the health objectives for the future. We have the Healthy People to 2020. What are those documents? There are documents when we have established goals that can be achieved in 10 years, in the near future, or in long term, mid-term, or long term. So go there and check on the WHO website the new trends, the trends in diseases, and also the new established goals. All right. Any questions so far? And I'm still with the marks, the yellow marks here. Okay. All right. Okay. Questions so far? I know that it's dense for just one class. The content is dense. Now let's talk about the determinants of health. Determinants understand as any factor that can modify the health status. So all the determinants, all the factors that they can shape or they can modify your health status. These determinants, they can come from the environment here. Now I know how to erase, I can use again. They can come from here, environment, that we call environmental factors. We have biological factors here and social. For instance, for environment, the disasters, war, urban crowding, toxic agents, physical agents. From genetic factors, behavioral factors, lifestyle and immunization, and the social here that I told you guys. For me, one of our most challenging tasks of public health is to face social determinants. Just like isolation, the cultural and political factors, educational factors, and economic factors. So keep in mind that all those factors together, they can shape and they can change. And see how complex it is to deal with all this factor together to achieve or to protect people's lives, to keep them healthy, or to prevent the diseases. Education, we can point here, like in education. So if you go and see the results and some findings, it's not new saying the poor people, they're struggling more because lack in education leads a lack in income. So probably if you are not well educated, you won't make enough money to provide decent education for your family, and probably you won't have access to health care the way that we expect as an ideal way. As I told you, some of countries, they see health as a right, some of don't. So some of them, they do believe in meritocracy, so saying that it's entirely up to you to achieve health. And this is a tricky and this is very complex web of factors that we should go over to understand this relationship between the context a person lives and all the implication of these domains or these factors. Here we have the environment here, the individual, and the agent. So for the occurrence of any disease, we need a person that will be the vulnerable one, and we need the agent to cause a specific disease. And remember again, in some cases, we do not need just one agent aging over a vulnerable. Most of the cases, we are facing a multifactorial diseases that we really need the synergy of some factors, some different factors, social, biologic, environment over this vulnerable, and this can cause or not the disease. And here we have information, education, peer norms. So also the type of society you are in, political, cultural, it also influences your health. Sexual behaviors, condom utilization, multiple partners. This is a good example for HIV. We have a vulnerable, we have the risk groups, and we have the flow of the spreadness of the disease. And in here, the way that we can prevent. So remember one of our past slides saying first, targeting a problem, discover the problem. Then, after doing your needs assessment, trying to find the answers, apply the correct methods, evaluate, assess, and propose an intervention, and always keep monitoring and tracking your results. We have some more conceptualization of the determinants of health here. We have the two tracks or two arms. First, the health field concept, considering the human biology, environment, lifestyle, and your behavior, and also the influence of the healthcare organization. We are saying here, we are just showing to you different ways to group the health determinants. So the first one here, health field concept, considering the integration of human biology, environment, lifestyle, and healthcare organization. The second is the ecological perspective, considering physical determinants, social and cultural determinants, and behavioral determinants. So we have different groups, and we have the different ways to organize these dimensions, but one thing should be very clear, and always remember that the context plays a huge role in the health of the nations, in the health of the populations. So if you're trying to figure out or to solve a problem or to understand better an outbreak, we need to understand the context. We need to understand the political scenario. We need to understand the contextual scenario, the society. So that's why I told you guys, the tools are universal. You can use the tools of public health here in US, in Kenya, in Singapore, in India, in Zimbabwe, in Italy, in Canada. But most importantly, you need to understand the right way to use them. So that's why you need to understand the broad picture. When I'm saying the broad picture, I'm saying all the contextual effects. So understand all the determinants of health, not only the biological ones, but social, behavioral, and environmental factors. So does it make sense? Checking my time. I think that we are a bit out of time. Dr. Suhail, can I keep going? I think we are almost at the end.
I think we can keep going.
Okay, thank you. We have here a list of the 10 essential public health services. Most of information here you already heard from me in the previous slides. Monitor and also remember Sherlock Holmes, investigate and diagnose, inform and educate. Again, we talk about this. We need to translate into a lay language how people can benefit from our findings from public health. That's why we need to keep working on health prevention and health education. Mobilize partnerships, it's extremely important. All sorts of partnership, not just from the public system or the government, but with nonprofit and with the private sector for sure. Enforce laws and regulations, linking people to needed personal health services. Ensure talented people to work. So in the past, I was to find a way, because I do love public health. I've been on this field for 15 years. And I found I would like to do more. So I found that being a college professor, I could multiply the number of public health practitioners and public health advocates. So yeah, assure that we have skilled and talented people to work in favor of public health. Evaluate effectiveness, accessibility, and quality of health services. Assessment, evaluation, research, and apply innovative solution. Invite people from bioengineering, from computer science to work and to think together about innovative solutions. We have now all the apps for cell phones. Another movement that we call Medicine 2.0 or Medicine 3.0 is a new way that we are reorganizing our communication, so channels of communications between us and our patients. Yeah, so keep also this in mind. The workforce, public health, diverse, multidisciplinary here, but I prefer putting here as interdisciplinary field. And so that's why we're talking when we need people from all types of, not all types, but some areas of expertise, like the biostatisticians, dietitians, environmental health specialists, behavioral health specialists. Bring diversity to your table. This is one of the beauty of our area, diversity. And at the end here, our core functions, look at it, starting here in the blue, it's improve health. Sometimes you can ask me, okay, Dr. Borges, sometimes we live in communities that we do not have the resources, can be financial or human. Try to establish partnerships. So ultimately, we want to improve health always, to protect people, protect health, and be an emergency prepared. Talking about the link between health and the development, if you go online, you students, and if you check some health indicators, again, if you go to the World Health Organization website, you can search for mortality indicators, and you can compare. So the health status of a nation can tell us how bad or how good this nation is. So when we are dealing for health, public health, the problem is not the huge pie, and if we consider the total income of the country, of the total money of a country. So for us, it's not important just considering the big pie. No, it's important to consider how this pie is shared. The more equal this pie is shared, this cake is shared, the better results, or the better, we'll see better health status of population. So everyone can benefit from health, and we can always improve and remember that health increases human potentialities of all sorts, of all kinds. So health is really related to achieving better opportunities in life. And we can talk about nutrition. And here are our challenges. Dealing with the paradoxal, because dealing with collective instead of dealing with individual, political conservatism and public health. So depending on the nation you live, you have problems of how the politicians understand health, and how are they willing to really to contribute and to make efforts towards public health. Economic impacts. We know some hidden results that can impact the marketing and promoting public welfare versus individual liberty. Paternalism, so some nations are very paternalistic versus libertarianism, public health measures, religion issues, cultural issues, values and responsibilities, surveillance versus cure. Some of our strategies here. Again, working towards new vaccinations, behavioral, individual, and community. Political lobbying. This is very challenging. And it's structural. Laws and regulations. Always advocate. So after all this explanation of all this class, is it easy to work in public health? I can assure, no, it's not. But if you believe, and it's not being so idealistic, public health, you can improve when you're surrounded by the right people, when you're surrounded by politicians, or you're surrounded by heads of organizations that they really want to make changes or protecting people's lives. Here a list. I'm not going over each one of the title. You can read it later. The key strategies of health promotion. You can go online and check all the documents. And lastly, I think public health is for all of us. You do not need to be a public health student to be involved. I think all the citizens in the world, in some sort, we are connected or related to public health. And public health is for all of us a rich, dynamic, and very multicultural, interdisciplinary field. We have so many challenges, and I invite all of you that we can talk later about the field. As I told you, this is a very dense discussion. And if you like also going for leadership, we are preparing the next generation of public health leaders. Being assured that we are doing the right recruitment, training and educating our professionals. And public health think about the public health as the floor for any other health-related profession. I know that I have the bias of being so passionate about teaching and really working on public health, but I see public health as one of the ways that really we can make this place, this globe, this world a better place to live. And yes, sorry for going 10 minutes ahead. And thank you all for your time, your attention. Let me know if you have questions. Thank you, James Lynn Institute, for this kind invitation.